This conference will now be recorded.
And we'll be going soon, so we'll be having to do the roll call, Madam Clerk, to approve things. And at this time, we'd like to stand and have Reverend Tommy Knight with Dublin First Baptist Church come lead us in our prayers. Mr. Martin, follow with the pledge, please.
Let's pray. Almighty God, Heavenly Father, we thank you for this evening tonight and for these men and women who serve as commissioners, Lord, in our county. May you give wisdom tonight to the proceedings, Lord, as many decisions are made for our county for the good of our place. Thank you, Lord, for each one that's come here. I pray, God, today that wisdom would abound in this room, and ask for your guidance and direction, Lord, in all that is said and done. Thank you for that. In the name of Jesus Christ, amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Is camera on? Where's he at? Mr. Cameron, can you hear us?
Yes, sir, I can.
Thank you, sir. Before I get a motion, yes, sir. Before we get a motion on the consent items, I'd like to remove 3B due to Mr. Williams' credit will not be here tonight, and 7A, 3B, and 7A. Mr. Marsh says he's got a couple other things to do before we will be handling that.
Motion to approve.
Got a motion by Dr. Mungorms on the consent items. We do it all through. Second. Got a second. Mr. Ellis, any further discussions? All in favor, say aye. Sorry, Madam Clerk. Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Cameron.
Dr. Mungoen? Yes. Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Individual delegation wish to address commissions. We've got Tracy Hyde. Come forward, yes, ma'am. Integrated Family Services to update regarding our mobile crisis unit. Feel free to sit down, yes, ma'am. Good evening.
Good evening. I do have a PowerPoint. Thank you. I can. Okay, perfect. Thank you so much. Good evening. My name is Tracy Hyde. I am the project manager with Integrated Family Services, specifically with our crisis department. So as you're aware, on February 1st, the county transitioned to Trillium Health Resources as the managed care organization overseeing behavioral health services. So with that transition, Integrated Family Services became the new crisis provider for the county. I know that we had an education session before that transition, but just as a brief overview as far as just our organization and who we are, for those of you who may not be aware, Integrated has been providing services since 2003. We've been doing mobile crisis since 2006. So although we are new to Bladen County, we are not new to providing these services. We are a preferred access agency. We also are a valued provider and a CABA certified agency as well. We are nationally accredited with CARF, and we have several MOUs and working relationships within the communities that we serve. We currently have 10 office locations. Our closest office location to Bladen County is in Wilmington. However, luckily with the crisis services, they can be provided remotely, so we don't necessarily have to have a physical location. We hire individuals to provide crisis services in the counties that we serve, so that they can respond quickly and get there within our allotted amount of time. So the services that we primarily serve, as I mentioned, are our crisis services. So I'll specifically talk about mobile crisis, which is our next slide. So mobile crisis is a service that is primarily in effect for diversion. So it's to keep people out of the hospital and jail diversion for those who have behavior health needs and don't necessarily need to be in the hospital. Behavior health, that includes mental health, substance use, or developmental disability individuals who have concerns related to any of those categories. Mobile crisis is a 24-hour service that is in place so that individuals have an alternative so that they don't have to feel that the only option that they have is to immediately go to the hospital. Because oftentimes when you look at data and statistics, that is the main reason someone goes to the emergency room for behavior health reasons, is because that's the only thing they know to do. So mobile crisis is an alternative to that, where we're able to go to them and we're able to provide the service in the comfort of their home and determine what is the most appropriate level of care for that individual if it's not the hospital. We're also a service that can aid first responders. So if they're not going to the hospital by default of that being the only thing they know to do, they may call 911, and then you have EMS or law enforcement that is involved in utilizing resources, again, that may not be the most appropriate. We can be considered your first responder for behavior health. So we can aid, although we hope to be able to get involved before those first responders get involved, if a first responder is contacted, they can call us so they don't have to feel like they're out there alone or that their only option is just to take the person to the emergency room or arrest them. We can be an alternative to that. So when services are utilized, and they are for anybody in the community, it is not a service that's only available to other professionals. It is available to families, to individuals themselves, or to other professionals to use when there is a crisis situation. So when you contact mobile crisis, basically what you can expect is, first and foremost, is 24 hours of service. There's always some form of response available. You're going to get access to a qualified mental health professional and licensed professionals at all times. So those who are experts in those fields are available to determine what the level of care is needed for that individual. We're going to provide them with access to resources, so linking them to the services that they need. So we, with our model that we use through mobile crisis, which may be a little different than what you may be used to, is that we not only respond to the initial crisis, but we focus a lot on prevention, which allows us to stay involved to ensure that they get linked to the treatment that they need, so hopefully they don't go back into another crisis situation. The service is, again, available to anyone, regardless of age or insurance status. As long as they are physically within the county and they are having a behavior health crisis, they can utilize the service. I know Bladen County gets a lot of folks that are here vacationing, things of that nature, and they go into crisis too. Their kids, family members, things of that nature, and the service can be utilized as long as they're in the county, even if they're from another county. We are a short-term service, so although we do stay involved long enough to ensure that they are successfully linked to the services that they need, we are still a short-term crisis intervention service and as far as the amount of time that we are involved, it varies depending on the situation. We do believe, in individualizing treatment, so we individualize how involved we are based on what their needs are. And then when you contact our service, as I said, we're 24 hours a day, and we are a first responder, so we do respond immediately. Now, we're a little different than, law enforcement, EMS. We don't have sirens and things of that nature, but we do have a 2-hour response window that we have to respond in that is allowed by the state. So we have up to 2 hours to respond. However, our agency expectation is that we go immediately and we try to get there as soon as humanly possible to serve the individual or the professional that is working with the individual. Next slide. So the process for mobile crisis is very simple. It's contacting our 24-hour hotline where you will speak to a live call center specialist. That person is going to gather the needed information, and then they're going to dispatch the mobile crisis staff that is most appropriate and is closest to that call. So once that person arrives, they will do what we call is a biopsychosocial assessment. They utilize many tools, clinical tools, to help go along with that assessment. That includes suicide screenings, a depression screening. We do a trauma screening. And then we also do what we call a social determinants of health screening, where we look at environmental factors as well. So we take all that into account during our assessment process, and then we do, or the person that's on scene with the individual does a together they come up with what the recommendations are for that individual. And then we provide those to the person, their family, and anybody who's involved that we have consent to provide that to. And then in the ongoing hours and days following that initial intervention is when we get them linked to the services that they need, whatever that means for that person. So just and you may be interested in, how does it work? Does it work? So our clinical outcomes from 2021 are what we have. In 2021, for this data, we served a little under 4,000 individuals. So that's what this data is based off of. One of the main reasons for the service is diversion. So in 2021, we had 73% diversion rate of those. There was about 3,800 individuals that we saw that we were able to keep them out of a hospital setting. So that goes to show that most behavioral health crises do not need to go to the hospital if you utilize the right resources. A big question is always how long does it take for us to get there, and then how long statistically do we actually arrive. So in 2021, again, based off that data, 86% of the individuals we saw, we did respond within 1 hour. In Bladen County, we are responding, again, we have kind of people strategically located across this team, so to speak. We cover 4 counties, New Hanover, Brunswick, Columbus, and Bladen now. So we're averaging about an hour to hour 15-minute response in Bladen County right now. That's a little bit longer. I mean, it is within our 2-hour window, but it is longer than what we would like to have. But we unfortunately are not immune to the staffing shortages that's kind of affecting everybody right now. So we do sometimes have to pull from our Wilmington area and things of that nature. But we will get there within the 2-hour time frame, or we should keep getting there within the 2-hour time frame. So that's kind of mobile crisis in a nutshell. Since February of starting services, we've served about, we're still gathering this month's data, but right now we're at about 16, 17 individuals in Bladen County. Now, I know that may not seem like a lot, but of course it takes time to educate the community and build the knowledge of what the service is and when to utilize it and that sort of thing. So that's what we're doing. That's part of my role, is to educate and make sure those who work with individuals who have behavioral health concerns know that they have access to this service regardless of what their age or status is. In addition to mobile crisis, we do offer a few other services to the county. So we offer crisis chat, which is a 24-hour online service where you can chat with a behavioral health professional 24 hours a day. So another way that folks can reach out. This is available to any age. There's no charge for this service. We also offer a service called CISM, or Critical Incident Stress Management. This is a service that we offer for larger scale traumatic situations where we go in and we debrief with those who have been exposed to a traumatic situation. Most often this is used in the death of someone, whether that's death of a first responder, death of a student, or staff member. But this service is used where we can debrief those who were exposed to it in hopes that they get back to a better level of function in a quicker amount of time. And then we also offer outpatient therapy via telehealth to Bladen County as well. So I hope I didn't go over my time frame, but my information is here. If you have any questions, I'll be happy to answer them.
Tracy, I think one thing that's really important to a lot of folks, it was a enjoyable topic when we were at the college, when you were out there with Trillian and all the folks, is that y'all don't quit at 5 o'clock on Fridays. And that's when a lot of things starts happening. And I think that's an important thing for families in the weekend and things. Something else?
I was just going to ask Tracy, what's the biggest media outlet that people have, like where your everyday folks would have the telephone number? In other words, for them to know to call you, I guess is what I kind of alluded to. In other words, you know.
Well, I did reach out to the Bladen Journal to try to get that. Dr. Duncan has helped with this as well, with getting the information to the health department. And I participate in almost every community meeting there is for the county. Now, we don't market on like television or things of that nature. And the reason for that is because of you got some close lines of counties where they go into other MCOs, and we're not available to them. So we don't want to false advertise or not be available and someone see it and think that they have. So we really try to market in ways of meetings, events, things of that nature. We participate in the resource events and all of that. So the Facebook page, I believe our information is up there. If it's not, it hopefully will be. It's been shared for that as well. So
the one I was wanting to ask about the mobile crisis, when you have a person that comes into the ER in crisis mode, and one of the problems that we have had in the past, still do, is that the length that person comes in, do you guys have a referral process to move people from point A to point B? Because sometimes we have to be left decision every one day, 2 days, because there's a mental health crisis.
right.
You have a referral network that you can move quickly.
So for us, I am or have and still in the process of educating the first responders. I've met with all of EMS. I've met with some of the local PD and working through the other police departments and the officers. So they would want to call us beforehand. So once they go into the ED and are taken there, they are kind of, for lack of better words, in their jurisdiction. At that point, mobile crisis can't come into the hospital. So we have to get involved beforehand. Now, I did meet with some of the ED staff to talk about when someone shows up at the emergency room, but they really don't meet the criteria for an inpatient treatment. Could refer them to mobile crisis if they don't meet criteria for inpatient, but they're still in a behavioral health crisis, which happens. So I have met with them, and the referral process is simply calling our 1-866 number and getting them referred to us, and then we would help with finding them the services that they need and making those referrals. But once they're in the emergency room, as far as finding them placement of where to go, we would not have any involvement in that once they are already.
Versus a family member, what I've noticed, person with Alzheimer's, and they're having complications with one.
Okay.
And they take them down, they have the officer to come pick them up. Do you guys intervene in those type of situations?
So ideally, yes. And we are working on educating the magistrates as well, because if an officer is intervening, that sounds like there's been an involuntary commitment done, because that's usually what happens. So what we want to happen, and what the ideal situation is before an involuntary commitment, especially somebody with Alzheimer's, is to contact us and let us see if we can get them the services they need and prevent all of that from happening. Because then getting an officer involved, especially in that type of situation, is going to be traumatic, and it's only going to influence the crisis and increase it. So if we can get involved, then but it's kind of the key to it is getting us involved before someone is transported to the emergency room or before an involuntary commitment is done.
I would advise that person.
Yes, that would be the best route. Now for Alzheimer's specifically, of course, that is a medical situation, but it comes with Alzheimer's comes with behaviors. So we can come out if they are having behaviors that is, delusions, aggression, depression, anything like that. We could come and address the behavior part of it as a service, not necessarily the Alzheimer's from a medical standpoint.
And to tie into that question then, especially on those type of clients, I guess that would be a great opportunity for those family members to contact you first, but maybe some type of network for those type of clients, right? Either through social services or some other facilities. But how do we contact you? Because I know about Trillium, but on the outlying areas, a lot of people don't know that.
People don't know, and that's
Right,
why
so
I've
how
asked
are we
about the
going-
number. People are not gonna know that number.
Yeah, right.
That's the problem.
Yeah, I know, I'm not asking to market, that's not it. But how are you going to, or you physically go into each one of those communities? I mean, there's a lot of them. I know Bladen County is lost.
Right.
But unless you go there, make a presence, and let folks know, they will never get that information. So if you could do that.
Absolutely. Yeah, and any recommendations for places that I can, I'm welcome to those. We really do try, and it does take a while when we're implementing into a new county, but we really try to go to the assisted living facilities, to go to the libraries, to go to the homeless shelters, to go to places that may not come in contact with a professional that knows the number. But so we try and do that as often as we can, and we do it ongoing. It's not something we just do we're gonna do this for a couple months. We do it on an ongoing basis.
But we do have those senior citizen facilities, right? That would be great.
Yes.
Because I think caregivers are there, the clients are there, and family members, that's the one. But I was gonna ask you about recruiting. What's your avenue of recruiting here in Bladen? Because we should have someone be willing to work. Exactly. Because that will help with the response time.
Right. And if anybody, again, has any suggestions, that is something we have tried to be very creative with. We do, of course, we advertise on the larger streams like Indeed and things of that nature. But we also reach out to local surrounding community colleges for people who are in the human services field. We do reach out and participate in job fairs. We're looking at some different platforms that recruit those seeking employment as well. Some different, I'm not going to name those because we're not with them yet. But so we're looking at different ways. But that's kind of how we. And then in every meeting I attend, I mention if anybody knows anybody who's looking for. We do have full time. We're fully staffed. So that's great. We were not at one a couple months ago. So we're better. We're in a better place now than we were when we started in February. Now we're really looking for folks who can help us after hours. That's where we look at that. So every meeting I say, hey, is anybody looking for some extra income? Because anyone who's as long as you qualified mental health professionals is what we're looking for primarily.
My last question, so you have a psychiatrist or someone at that level at 24 hours to support your clinical services?
Yes, so the workers that respond are qualified mental health professionals. Then there is 24 hours a day, there's a licensed clinical social worker, licensed clinical addiction specialist, and developmental disability specialist available. In addition, our medical director, Dr. Kim Reynolds, she's a child psychiatrist. She is available 24 hours as well for consultation.
My original question was similar to what Dr. Ellis said about public information and people being advised of your available services. You mentioned something that because of the areas or something that you could not advertise or something like this, maybe because it'll go across your jurisdiction. But couldn't you advertise on TV and radio and just specify the areas that you cover?
We could, that's something that I can revisit with our, management team and those who make those decisions about, marketing and how we go about doing that. We've not historically done television advertising, but that's something definitely as things change and times grow and all of that, and as we grow, we could revisit. So it's definitely something I'll mention.
Another thing too, you mentioned that, your response time between 1 and 2 hours?
The state allows us 2 hours maximum. Here, we're averaging, here about an hour.
So if you're arriving within an hour, how do you divert people from going to the hospital? If you, they call EMS, and how do you do that?
Meaning it's because they're going to have to wait because they're waiting. Is that what you're asking?
Yes.
Because they have to wait. So essentially, if EMS or law enforcement is there, and I spend a great deal working with them, we participate in CIT trainings for officers and that sort of thing. And kind of what I try to educate them on is if it's not emergent enough where, or if they can wait, they can wait that amount of time. There's going to be situations where you can't, right? So we can't avoid those, and those probably we go to the hospital anyway. Right. But if it's situations where someone, let's use an example of someone's having suicidal thoughts, but they're safe, they don't have a plan, they just having those thoughts. Instead of just taking them to the hospital, calling us out there, yes, you may have to wait 45 minutes, an hour and 10 minutes. However, in the long run, it's going to save time because that person is going to get the help that they need. Hopefully, you will not have to go to the hospital and sit for 2 or 3 hours with them, or transport, or however, whatever would be caused. And then you won't, again, in theory, won't have to go back out again later. They'll know to call us if this happens again. So yes, it may be a time investment slightly on the front end, but in the long run and for everybody involved, it usually saves time for them.
All right, thank you.
Mr. Anderson. So, I think you're doing a great job. I think we had community meetings. We got the word out. There might be some corners in this county that don't know it. And there's brochure.
We know what they did.
Have brochures that you could pass out to Dr. Duncan and them, and that you could put up to senior citizens. You need to spend your money on the citizens of Bladen County, not on television or radio. And I would just say that everything I've heard has been positive. I know y'all been here a couple of times. I think the first time you maybe right at 2 hours, a little bit over, but since then it's got better. And I have heard nothing but positive comments. So thank you.
The only thing I thought of this response, Mr. Peterson, is I'm looking at this simple line here. You guys provide just a simple thing.
Yeah, I have some with me. I'll be happy to.
This thing, have like a magnetic stick or stick on it.
We have what we call them RAC cards, or small cards that we have for mobile crisis and for our crisis chat. I'll be happy to leave those with you guys, so that you have them for anybody you need to provide the information to. And so yes, we send that, and we send them out electronically as well. We have bracelets, we have ink pens, we have notepads, we have a little bit of everything that we kind of, depending on the event that we're participating in, that we pass out at those events.
Okay. One more thing. Mr. Barton, could we do that reverse 911 call to share this number? We got that out. Yeah, just get with Greg and do that too. There's ways to do it.
Yeah, thank you. That's kind of what I was trying to do.
It is, and we know that there's people. I mean, there's meetings, there's counties we've been in for 15 years that I go, and there's folks that don't know about the service. So we definitely understand that there's getting the information out there is most important. So we try to be creative, but we're always open to any other suggestions and places that we could visit that maybe we haven't. Thank you.
Interventions, commissioners. Health Department, Dr. Jerry Duncan.
Good evening.
Good evening.
The first item we have is an update regarding the vital statistics, and we have Becky Colbert with us tonight to give that update.
Good evening. I'm here to give the vital statistics report, which is an annual report that I have to give every year as a benchmark for accreditation, as well as to let you guys know what's going on. In 2021, we had 321 deaths. We had 3 births in Bladen County. Even though we don't deliver, we did have 1 planned home birth, 1 unplanned home birth, and 1 that delivered in the emergency room. The unplanned birth and the emergency room were transported to Cumberland County Hospital after everything was settled. We also have, Bladen County now has an electronic death registration system. We've always had a birth registration, but never an electronic death. So as of May 1st, there's no longer paper. Everything is electronic now. All the doctors, the hospitals, every funeral homes, everybody was given a whole year from the pilot program to get signed up to do this. So we're still having some backlog of credentialing because of the short staff in Raleigh. I can't give you the number for Bladen County residents who died outside of the county because I have not been given any more I was getting a quarterly report from Raleigh until the pandemic happened, and I've not received anything since the last quarter of 2020. So I don't get a report anymore, and they're so far behind because of the pandemic and also being short-staffed like everybody else is. But the new electronic death registration system is called DAVE, and that stands for Database Application for Vital Events. And that's all I have, unless anybody has a question.
I just have one. Is there a delay in getting Social Security numbers for a new birth?
There's not, as far as I know. The EDRS system is being integrated into DAVE, but it will not be effective until January 2023. So, yes, ma'am. Anybody else? All right. Y'all have a good evening.
Thank you.
Our second item is regarding our 2022 health rankings, and we have some great news. The health rankings were released on April the 27th of this year by the University of Wisconsin Population Health Institute and funded by the Robert Wood Johnson, and we are currently 85th. That's up from 95 since 2018. When we look at it, we know that 85 out of 100 is certainly in the lower 25% of the health rankings in Bladen County, but it's not where we were. If you look at surrounding counties, in 2018, Robinson County was 100, and they're still 100. Columbus County was 96, and they're 91. So what kinds of things influence that? 2 things. Health outcomes and health factors. And the first health outcomes is 2 things: how long people live and how healthy they feel while they live. It's the health factors that the work that you did on the strategic plan, I think you'll see that you did some nice groupings of people that could help us impact the health factors. And those health factors include 4 measures: health behaviors, and that includes tobacco use, diet, exercise, the alcohol and drug use, and sexual activity. If you look at our community health assessment priorities for the next 3 years, it includes substance abuse, nutrition, weight, and nutrition, weight, and exercise as our first 2. Second measure is clinical care, and that is access to care and the quality of care. Third, the social and economic status includes education, employment, income, our safety, community safety, as well as family and social support. And then lastly, the physical environment includes air and water quality, as well as transportation. So you can see your 6 groups were very well done. So we are looking forward to help moving our numbers up. We need to be 74 to be out of that bottom 25%. So while it's not a great ranking, it's certainly better than what we have had. I can remember when we were 98, 99, or 100.
Duncan, could you, if you're prepared to do so, could you brief us a little bit on COVID?
Absolutely.
We have quite a bit of it.
So, all of the metrics or early indicators of COVID are increasing. And if you'll remember, CDC and North Carolina DHHS changed those metrics a little bit. One is the wastewater, and it has increased. Now, the new report will come out on Wednesday. So every Wednesday it's upgraded. But as of last week, the particles in the wastewater were at 14.1 million, and that's up from 14 million the week before. We anticipate all of these are going to increase, and they're already up. The ED visits for COVID-like symptoms increased from 4% to 3%. Again, this is across North Carolina. For the health system capacity, which is the number of cases, it increased from 23,000 from 17,000, roughly 5,000 cases. And hospital admissions increased by 91 cases from 431 to 524. As of today, we are not aware of any hospitalizations in Bladen County. And we know we've got roughly 100 active cases. Those are the ones that we know have been tested and reported, not the number of individuals that are doing home tested or not testing at all. As of this day, Bladen County is still in the green for the community surveillance. Remember, we went to that with CDC a couple of months ago. At the last report, there were no counties in North Carolina that were in the red. There were 10 counties in the yellow, and of course, Bladen was still in the green. We are anticipating that to increase. For folks that are in a yellow or a red category, remember we should, and we should even in our green county, look at your risk, and based on your individual risk, to determine whether or not you should wear a mask, particularly in a large group. And we know that vaccination is key to this. The 100 cases today means a little bit less than the 100 cases did this time a year ago, because we have the vaccination and other means. So the BA.2 variant of Omicron continues to be about 85% of the cases in North Carolina. We haven't seen a new one yet. We have 127 deaths total since its inception for Bladen County. We currently stand at a 74% first-time vaccination and a 64% second dose in Bladen County, and that's up about 2% in the last 2 months. We're averaging about 1% a month. Some of our surrounding counties haven't moved in that. So the EMS Training Center now is host to the testing group that was outside of the health department, because we moved that for the paving initiative. They will continue to be here through the end of June. The state is looking at how to move on in the future. They will leave a certain core even after June, so that if we have to vamp up in another major event, that we could do it more rapidly. That was done previously. We currently are giving the test kits at the health department. People, of course, can buy them, but we do have them available if people want to come. And we continue to give the vaccines every day at the health department. You may have heard as of Friday that we have now the booster available for ages 5 and up. And if you haven't gotten your vaccine or your booster, now's the time. In Bladen County, we're only running about 23% that have had that booster or the additional dose.
Are you still posting this on the Facebook page?
No, sir. It's available on the website, and it's available that one time a week.
I just walked into a situation that I've seen so much of it happening at one time. So I didn't know how many people were aware of it that I didn't notice. I thought it was kind of down like you were saying, but then I walked into a situation, I said, oh, wait a minute now, it was just kind of a little bit off the chart, what normally you would throw up on a red flag.
It started increasing Thursday, and Friday was a week ago was when we began to see it here. And then it was like 12 cases versus 4 cases a day. And then Monday, today was a week ago, we had 20 cases. It started coming.
Yesterday, our church, we passed out several home test kits from the church, and people seemed like they really wanted them. So we passed out quite a few of those yesterday at church. Another thing, is this monkey virus, is that what's happening now?
Monkeypox.
Monkeypox, okay. Is that in North Carolina yet?
Well, it's not in North Carolina that we are aware of, but it is in the United States. And the North Carolina DHHS issued a advisory to providers on that last Friday. It has been identified in multiple countries and in the United States. It is a rare disease, usually contacted from animal to person, so it can be spread person to person. So we're continuing to monitor that. We've sent out the alert to all of our providers, and more to come.
Thank you.
I have one question.
It's never a dull moment.
No.
That monkey around.
No, there have been cases with the Jeff peanut butter salmonella breakout. Have we had any cases in Bladen County?
No.
Good. I did have some friends in Georgia who they have, but not here. Even though they say it's from North Carolina, none have.
Well, there's people that's found it.
They found it, but we don't have cases of salmonella resulting from it. And we also, since we're talking about some other things, the formula shortage, we have sent out an advisory of the formula shortage and the advice from North Carolina DHHS for that as well.
So on this formula shortage, now Leland, now they're full right now. Do we expect them to still have enough to take care of the babies? I don't know about here in Bladen right now.
What was reported last week at the Public Health Leaders Conference, all things considered, in North Carolina, we don't have the shortage that some other states have. And we're anticipating that it's going to get better.
Item C, Dr. Dunn.
Item C is consider approving a memorandum of agreement with Federal State University, and that will allow social workers to come intern with us, and hopefully we can recruit some of them.
So moved. Motion by Mr. Peterson, second by Mr. Bullock. Any further discussion? Second by Mr. Gillespie. All in favor, say aye.
Aye.
Opposed? Aye.
Mr. Brett?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Yes.
Mr. McGill?
Yes.
Dr. McGowan? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes. Thank you. Finance Director, Ms. Lisa Coleman.
Good evening to each of you.
Good evening.
I'd like to review the dashboard ending April of 2022, 83% of the year. At the end of April, we had revenues collected of 73.08% in the general fund and spent 69.49% of the budget. Solid waste, we collected 72.75% of the budget and spent 62.63%. The emergency telephone, we've collected 25.08 and spent 16.61. And in the water department, we've collected 86.90 and spent 43.69. And as you are aware, in the ARPA money, we have only spent, we've only received 50% and we've spent none yet, but in the packet tonight, there was approval for the project ordinance. So we can move that money to take care of that. So then we can start spending the other money. Any questions on the dashboard? The federal inmate program, as you can see right now, we are $156,000 short for the year. So with the way it's tracking right now, we should have no problems getting that for the balance of the year. We're still on track. Thank you.
General Service, Kip McClary.
Good evening.
I have with me tonight Mr. Mike Brincheck, and he is with Smith Gardner and Associates. Item A was for request for agreement with Smith Gardner Engineers for engineering services on the transfer station floor and repair. They have a brief presentation here just to show you what the items cover in this proposed contract. If you're aware, in our current budget, we have some monies for transfer station floor repair. This will get them started on actually doing the engineering work for the design, the procurement, the construction management, and final certifications for the actual repairs that are required by the North Carolina Department of Solid Waste. Everything we do down there has to go through the NCDEQ, and this will provide us with that once the repairs are done. Keep in mind that the request tonight is to act on this contract, which is for engineering services. And in the proposed budget, we're asking for the actual funding to do the repairs, which we think is going to be fairly significant. Get this work done.
Motion by Mr. Peterson, second by Mr. Hester. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Yes. Dr. Montgomery? Yes. Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Thank you, sir.
Too easy.
And the next item I have is for completion.
Ladies, some motion to approve.
Second.
To approve.
Got a motion by Mr. Peterson, second by Mr. Gillespie. Any further discussion?
This position is in
This position's in solid waste.
solid waste.
Is the heavy equipment operator, the truck driver, the CDL truck driver that we're in need of right now. Keep operations up and going.
This will go to which side of
The trucking side of
the
the,
crooked side.
yes.
So I want to make sure we take that right side.
Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson? Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes. Yes.
Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Thank you. Can I get a motion?
Thank you.
Motion going to the board. Got a motion by Mr. Peterson, second by Mr. Bullock. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery? Yes. Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Yes, sir.
Okay. The next item we have is relating to a contract with LKC Engineering to begin work that pertains to our agreement with Chemours. Many of you know we worked on an agreement with Chemours. They have a requirement with the state to extend water services to some of the citizens that were impacted by the Gen X situation in and around Tobermory and the Live Oak area. We have talked with LKC Engineering, which currently does most of our engineering or all of our engineering services for the water department, the water system. They have all of our records, our maps, our permits, and all that information. What this does, it launches us into the, quote, first phase of working with that agreement. Now, the first phase of this will be to put filtration systems on the Tobermory well and the Live Oak well, and that is to be paid for entirely by Chemours. Those permits are already in the works and being submitted to the state for approval to construct. What this also does is it puts us in a quote-unquote pass-through position in that LKC will bill us for the services, which gives us control of how things move forward with the progress of the project, with Chemours providing us reimbursement for our expenses. So this agreement starts that first phase of this, but it also includes with LKC the future engineering that is coming for the extension of the water lines to get these services to these citizens.
Motion to approve?
Motion, Mr. Bullock, second by Mr. Hester. Any further discussion? Roll call, Madam Clerk.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson? Mr. Cogdale? Dr. Ellis?
Yes.
Mr. McGee?
Yes.
Dr.
Yes.
Montgomery? Mr. Bull? Mr. Gillespie?
Yes.
Thank you, gentlemen, for that.
Thank you.
Anything else, sir?
And the next item we have is a request for approval to hire 2 new positions in the water department.
Motion to approve.
Two? Yes, 2. One was be in the billing office, and the other would be in the field crew.
Got a motion by Dr. Montgomery, a second by Mr. Bullock. Any further discussion?
Yes, how many will you have in staff in the water, actually?
Department completely. That would put us at a level of 9. We currently have 7 now. That would give us 3 in the office.
Collection piece.
Yes, and that collection and billing, that would give us 3.
Is that the normal staff, normal?
It depends on the model that you work from, but most places have 3, so they can provide the rotation for the people to take their lunches and do the third party service.
3 bills enough, huh?
Okay.
Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson? Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGee?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Yes.
Thanks, sir.
Thank you. We appreciate it.
Motion to exit.
So moved. Second.
Got a motion by Mr. Hester, second by Mr. Bullock. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGee?
Yes.
Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Advisory Board appointments. Adult Care Home Community Advisory Committee 1, David Howell. A recommendation by Mr. Peterson on David Howell,
David Howe. Oh, okay, I second.
second by Dr. Montgomery. Any further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr.
Yes.
McGee? Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Dublin Fire Service District 2 people.
Motion to reappoint. Second.
Got a motion by Mr. Hester to reappoint, second by Mr. Gillespie. Any discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr.
Yes.
McGee? Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
County Water Night Drainage District Committee.
Motion to reappoint.
Reappoint Mr. Peterson, second by Mr. Bullock. Further discussion? Roll call.
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Yes.
Mr. McGee? Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Nursing Home Advisory Committee 2.
Heather Ellis to replace Jamie Rivera, Jamie, Morris.
Second.
Anybody else? Okay. Motion by me, and second. Yep, need another person.
Ms. Jessup, she wants to not no longer be there?
No. She's gone.
Can we just appoint that one and say the
Can
other?
we take the other one?
Yes, sir.
Yeah.
The motion by Ms. Heather Ellis, and the table second. Other discussion? Roll call?
Mr. Britt?
Yes.
Mr. Hester?
Yes.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Yes.
Mr. McGee? Dr. Dr. Montgomery.
Yes.
Mr. Bullock.
Yes.
Mr. Gillespie.
Yes.
Southeast Community Action Partnership, one.
You gonna do it?
Rodney has.
Second.
Got a motion by Mr. Peterson for Rodney Hester. Who seconded? It don't matter. Gillespie. Any further discussion? Roll call.
Mr. Britt.
Yes.
Mr. Hester.
Yes.
Mr. Peterson.
Yes.
Mr. Cogdale.
Yes.
Dr. Ellis.
Yeah.
Yes.
Mr. McGill. Dr. Montgomery. Mr. Bullock.
Yes.
Mr. Gillespie.
Yes.
I won't call them out, but keep in mind, on June 20th, our next advisory board appointment. There's a bunch of them. Mr. Martin.
Thank you, Mr. Chairman. I'd like to briefly review the calendar with you for the remainder of the month and as well as June. And point out that tomorrow evening at 6 p.m., the Municipal and County Association of Bladen meeting will be held at the Curtis Brown Airport large room there. And that starts at 6 o'clock. Also, just want to let you know, we received an email late today that the Highway 701 bridge will not close tomorrow. They need to reposition the crane. They'll open again Wednesday. It also indicated they hope to complete work Thursday.
Wow.
And they
It's done quicker than they
they're
thought.
apparently right on my head. That's a good thing. Also, want to remind you that county offices will be closed Monday. Moving over to June, JCPC meeting on Thursday the 2nd at 12 noon. On Monday the 6th at 8 a.m. there's a prayer service here. The board meets that evening at 6:30. On Monday the 13th at 5:30, the Health Services Advisory Board meets. The Committee of 100 annual dinner will be held at Keckner Winery the 14th at 6 p.m. And on Saturday the 18th at 12, there's a prayer service here on the courthouse lawn. Board meets on Monday the 20th at 6:30. Saturday the 25th, 10 a.m. until after dark. There's a candlelight vigil and drug awareness event held at the Bladeboro Historical Building. Also that day from 12 until 4:30, there's a community fun day at the Ransom Activity Center. Questions about the calendar moving ahead?
Can I just, up on one?
Yes.
The Agent Advisory Committee meeting will be on tomorrow, the 24th at 3 p.m.
Mr. Martin, I would like to mention one thing on the bridge, and all I'm gonna do is repeat hearsay, but it was a good question. My understanding on the bridge, when it closes down, that they're unloading off the bridge, the truck. And the question that come up about that, just so you know, like I said, because I personally don't know, but with the weight structure of two trucks, the heaviness of that is, the question came is, why, if all that weight had been there, why could that bridge not stay and maintain for emergency in the event you would ever had to come down?
The one I was observing, I sat there observing it one day, waiting on my granddaughter who had a few minutes to kill. They had one truck there, and they wasn't looking one truck at a time. They want one truck on the bridge.
Mr. Chairman, I was there today, and it seemed like the truck, like you say, was on the bridge, on part of the bridge, but and they had the load on the bridge too. So it's pretty large.
But that was the question, because people are just looking down the road. If we've got a problem, you're gonna be going 11 and you're going to Tar Heel. So shut it down.
The only thing that I asked the same question, and I asked one of the engineers to stand out there. And at one time when they stopped, it laid that move of putting the bridge pieces in place. He said that the ground there was so unstable that they had that crane get ready to lift some weight. They had to shut it down. He said the ground there is completely unstable. They had to go in there and put more reinforcements upon that crane to keep that thing be able to lift that.
Well, I think that was one of the questions, because I heard a comment from one of the engineers.
He said the ground was just.
Originally, they weren't gonna unload, from what he said, off that bridge.
Yeah. But they put some kind of enforcement. They had to bring some stuff in by barge. They put it down in there like a platform, putting that crane on it because they said it was sinking in the ground.
But Mr. Chairman, I thought when the bridge had problems, the one on the west side was worse than the one on the east side. That's what, you know,
Well,
I'm sure they've done engineering studies on it.
So the guy said the ground was unstable. That ground just wasn't there. Because they couldn't put that kind of weight in that crane on.
Go ahead, Mr. Moore.
Okay, thank you. Moving on to B, just want to remind you, we have public hearings scheduled for June the 6th related to the budget. I just wanted to see if you'd like to go ahead and schedule a next budget work session.
Say when? When you say that?
The first meeting in June will be the public hearings. During the regular.
If we don't, we need to schedule another meeting in between there.
That's what I was asking. That's what I'm asking to see when you want to get it.
Come up with a date. Everybody is there.
So we need to do it before.
We're doing the,
What's the date of June?
June the 6th.
And the 6th is when we have the public hearing.
I mean, it doesn't have to be before that. I'm just telling you that just for reference. But I'm just let you know. Sometimes you do.
Well, you need to make sacrifices. I know last time we met, I missed my granddaughter's graduation and everything. So some of you need to make sacrifices when we're trying to decide what dates instead of just.
What about this coming Monday?
okay, that's Memorial Day weekend. Sounds good to me. Sounds good to me.
That's Tuesday. That amount?
I'll be back Monday evening.
I'm gonna do Monday.
Tuesday. Monday?
Yeah.
I don't want to do Monday.
That's a Tuesday. Tuesday.
Wait a minute, I got
Two days to you, but I don't want to do Monday.
I got some other money. Hold on.
I can't go Tuesday. I've got softball. I'm missing the more granddaughter's softball and graduation, I'll tell you right now.
I mean, do you want to do Monday?
I prefer
Yeah.
Monday.
I don't want to.
Tuesday.
What Wednesday look like? Can we do it Wednesday, early Wednesday?
I won't be here. I'll be at, Raleigh. I'll leave my morning. I do Thursday. But I can't.
Thursday.
Second. June
Oh,
2nd.
no, I can't. I'm sorry. I'll come back until, Friday. Well, you can do it. I can do, remote. I can do remote.
So what day are we looking at?
Whatever you can do.
Do Thursday, 5:30, we're looking good. Nope. You can't do it.
I ain't missing no more. I done miss.
Talking about Thursday.
I done missed graduation and everything like that last meeting. I ain't.
So you got one Tuesday and Thursday?
Yep, I ain't missing no more. I sacrifice that. I ain't gonna sacrifice no more.
Then you have Monday or Wednesday. And like I said, I will be glad to, I can do Monday, but Wednesday I won't be here.
They sacrificed the same thing last Thursday.
Well, nobody want to do it on Friday, that's how they that way.
I'll do it on Friday.
What about Friday?
I'll get back on Friday.
5:30 Friday.
What about the Wednesday, if you don't want to do a weekend?
I leave. I can do it, but I can do remote. Yeah.
You do it remote?
I can do remote.
I'm good on this.
That's the first, June 1st?
Oh, wait a minute, is that right? Oh, I thought somebody did come in.
That's good, June, you said June 1st? Something else is good with you?
Oh, that one?
But next.
June 1st.
Okay, I can do that. I'm
No,
good.
so that ain't good for him?
That's not good for you?
No, I can do it. I'll do it. I mean, I'll do it. I just didn't want to do Memorial Day Monday. I mean, I'm sorry. I mean, I got it.
So we
I think everybody understands that.
For June 1st, 5:30? Everybody good with June 1st, 5:30?
I work every day.
June 1st, 5:30.
I make a motion, we do, a meeting on June 1st, 5:30.
That'll work, I say 5:30. Wednesday.
Church start. Cameron church start.
Yeah, back from Bible class. Bible class.
I'll be there.
Do early Wednesday.
Thank you.
Thank you, sir.
So we still have the one on the,
That's 5:30, June 1st, roll call, Madam Clerk.
Mr. Brett,
Yes.
Mr. Hester.
Yes.
Mr. Peterson. Mr. Cogdale.
Yes.
Dr. Ellen.
Yeah.
Mr. McGill.
Yes.
Dr. Montgomery.
yes.
Mr. Bullock.
Yes.
Mr. Gillespie.
Yes.
I have a question, Mr. Chair.
Yes,
We
ma'am.
still have on June the 4th, we still have, or the 6th, we still have that one that morning, that night, before our meeting, or not? We don't have a meeting. Okay.
Oh, really?
Okay, good.
And then schedule it for.
Equalization review at 5 o'clock.
We got the pictures thing, yeah.
Yeah, picture.
I got on this
Oh,
Monday the 6th, equalization and review at 5.
That's what I'm saying.
That's what I thought, it's at 5. If it's still on, I want to make sure, at 5. Okay. That's at 5:30.
Okay, Mr. Mark.
Yeah, thank you. Item C, just wanted to share with you the proposed holiday schedule for 2023. And you have, this is following the state calendar. Additionally. But if you have any questions or please let us know. We'll plan to include it on the agenda for adoption June 6th.
You got 12 days.
Yes, sir. Then moving to the next two items, they're both related to ARPA applications. And if you have any questions about either, that's fine. If not, if you want, Mr. Chairman, just in the interest of time, consider adopting both together.
Motion approved. Got a motion by Mr. Peterson on D&E, got a second by Mr. Hester. Any discussion?
I got a question.
Yes, sir.
On page 2, Mr. Chairman, it talks about DNS numbers and SAM registration numbers.
They're not required though.
Those are required?
But the only need for federal grant.
Page 2. DUNS number and SAM registration number. Are those,
That'd be if necessary.
Optional?
that's optional?
Okay.
Okay.
Any further discussion?
No, Mr. Chairman, the dates on this. Do we feel? The dates here. You're, okay.
You say you make hard copies available.
Okay.
All right, thank you, sir.
Yes, sir.
Mr. Brett?
Yes.
Mr. Hester?
Yeah.
Mr. Peterson?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Mr. McGee? Yes, thank you.
Dr. McGowan? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Okay.
Thank you. And then the last item, Mr. Chairman, is to request the board to consider approving an agreement with Trillium Health Resources for professional services.
I'm much approved. Got a motion by Mr. Peterson, second by Mr. Hester. Further discussion?
With that.
Should you, is this thing,
It's related, I'm sorry, I should have, it's related to $500,000 for the inclusive.
thank you, okay.
That's
Thank
where
you.
the register is.
All right.
Roll call.
Mr. Chairman, where is Trillium located?
Reading home base.
Up in northeastern North Carolina.
I mean, in Bladen, where is it located?
Nowhere.
He was gonna tell you now, they're located at Bladenburg Historical Society.
Oh, really? When did that happen? I didn't know.
That's where they come in, that's where he told you, he told you, 2 or 3 times, told us.
He didn't tell me.
He told the board a couple times. Well, I'm sorry. See, look, that's part of the PowerPoint you got me computer.
That was gonna be the health department, so we decided to change that. I'm just asking, if we change that, that was gonna be the health department. I'm sorry.
They have people there at the health department, at social service.
Well, they got employees both places.
I don't know what they got there, they got a contact person there.
Where, in the health department? And how many in Bladenboro?
He said health department and social service.
And social service, okay. So we should at least two.
I mean, Dennis is gonna do his presentation next month. I don't know how many, I haven't been in there. I don't know how many people's in Bladenboro.
Roll call.
Mr. Brett?
Yes.
Mr. Hester?
Yes.
I'll tell you,
Peterson?
yes.
Mr. Cogdale?
Read more.
Dr. Ellis?
Yes.
Mr. McGill? Dr. McGowan? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Individual delegation wish to address Commissioner, Madam Clerk. Matter of interest to Commissioners. Get a motion to enter closed session.
Motion to go in closed session.
NCGS 143-31811, attorney-client privilege, and NCGS personnel.
Motion to go in closed session.
Got a motion by Mr. Bullock, second by Mr. Gillespie. No discussion, roll call.
Mr. Brett?
Yes.
Mr. Hester?
Yes.
Mr. Peters?
Done number, just, that's a business number, some people don't even have it done.
Ms. Peters?
Yes, I'm sorry.
That is-
Mr. Cogdale? Bring that back.
Cogdale?
Mr.
Cogdale, we need a vote.
Mr. Cogdale?
Vote second, yes.
Oh, yes.
Dr. Ella?
Thank you.
Mr. McGee?
Yes.
Dr. Montgomery? Mr. Bullock?
Yes.
Mr. Gillespie?
Yes.
Hey, this time, folks, we need this room,